Hello, I'm Ziad from Single Best Answer. If you haven't done so already, do check out our website www.singlebestanswer.com. It's an essential revision tool for any medical student revising for medical school and preparing for the UK MLA exam, or even doctors abroad who are sitting the exam to come practice in the UK. So what's really special about our website is we have mapped the curriculum of the GMC UK MLA examination directly onto our website. And today I'm going to go through a presentation, which is back pain, and also cover with that some challenges that students often face dealing with data interpretation. So we have a 53-year-old man who has acute back pain for the last 10 days. He reports a few months of feeling generally unwell and lethargic. Occasionally he notices some swelling in his ankles, particularly at the end of the day. Now here we have a host of investigation results. The important thing here is to take your time reading through these results, because this is where the answer is. And don't get distracted looking at the options below. One of the things that we focus on, and the GMC is very key on with the UK MLA, is the cover test, which is you should be able to answer the question without looking at the options available to you. Let's look through the investigation findings. We have a hemoglobin of 92, a little low, a sodium of 141, which is normal, potassium of 5.4, marginally raised, urea of 19.3, which is elevated, creatinine of 327, which is markedly elevated, so we automatically can see there is an AKI, acute kidney injury. Corrected calcium is elevated, 2.9. Albumin is 36, and there's a clue here. The total protein is 91, which is significantly higher than albumin. We'll come back to that in a moment. So looking at all this together, the next question is, what is the single most diagnostic test? Now, this question requires two-stage thinking. You need to think about what the diagnosis is, but not just that. You should also then think about the best diagnostic test. So let's focus on what key points and objective findings the question tells us. It tells us patients got back pain, lethargy, AKI, hypercalcemia, and a slightly low hemoglobin. Protein is normally made up of albumin and globulin. So if the albumin is normal, but the protein is very high, then there must be an increased amount of globulin in the blood. Putting all this together, this is quite a tricky question. The answer here is multiple myeloma. So we then look to the options. Which of the diagnostic tests here tell us about multiple myeloma? And usually it's a serum and urine protein electrophoresis. And that's option D. So let's click on option D, but let's look at all the others. Parathyroid hormone, that is useful in thinking about hyperparathyroidism. Now that could give hypercalcemia, but it wouldn't explain all the other blood findings. Renal ultrasound, that's a useful test in assessment of acute kidney injury, but again, it doesn't explain all the other symptoms the patient is presenting with. Serum ACE, not a very helpful test, but what this one is referring to is sarcoidosis, which again is unlikely here given all the other findings, particularly the abnormal hemoglobin. Vitamin D levels, again, too much vitamin D would not give you this presentation, so it's the wrong answer here. Let's click on the answer and let's see what it tells us. Indeed, that is correct. Now, this is a tricky question. We've got plenty of those, but you can also, on singlebestanswer.com, select questions of varying levels of difficulty, so you can tailor your revision. So if you haven't done so already, please head over to our website or subscribe to our YouTube channel so you can see more videos like this. Good luck in your exams.